to do now is just take you through our STOPIT coaching model. When I did my coaching training, what they said was advice was out. So you couldn't give people advice. But what they said was you could use stories from other people as a way of kind of maybe giving some people who didn't really know where to even start, you can give them some ideas. So I thought, well, that's great. What I'll start to do is to kind of capture stories from people who'd had some success in lifestyle change, and then I'll be able to use those stories for other people. So I'd ask them, so how did you stop smoking, or how did you manage to lose weight? And you know what people said? I just did. And I thought, actually, as a bit of advice for people, just doing it is not really going to cut it. But when I said, well, you know, just before you just stopped whatever it was that you were doing, what was going on in your life? And then a lot of other common themes came out, and that's what's become the STOPIT model. So each of the letters stands for something, so that's quite straightforward and easy. So S stands for what are the signs that you need to make a change? Because people don't tend to just make changes. There's generally a whole load of reasons why people decide to make a lifestyle change. And actually what I encourage people to do is get as many reasons as you can, because actually that builds a bit of momentum to kind of leave what you're doing and start moving towards something new. And I think it's a little bit like a rocket ship. And if a rocket ship needs to escape from the Earth's atmosphere, it needs to be going at a certain speed. In order to go at that speed, it needs to burn a certain amount of fuel. If it doesn't have enough fuel, guess what? It either doesn't leave, doesn't even start, or it will kind of go so far and then fall back to Earth, which can be a little bit what it's like for people making lifestyle changes. They can make a really good positive start and then not go anywhere. So getting enough reasons for people to start moving is really important. So T stands for what would someone you trust tell you about the importance of this change? What I recognize is that making changes is difficult, and actually having people around you that can support you with those changes can be really important for some people. Not everyone, but certainly for some people. So I'd get them to identify someone that they would trust, and what they would tell them about it can be really helpful, especially when people get to a point when they're making the change where they're struggling. Just having that person alongside them, or just remembering what they might say to encourage them, can be really useful. O stands for outcome. And so if the signs are the push, the outcome is the pull. People have got to have something that they want to move towards, as well as something they want to move away from. Otherwise, what can happen is people can start moving away from one situation into another situation which is not much better. So people can leave one stressful job and end up in another stressful job. Or one bad relationship and end up in another bad relationship, because all they're doing is moving away from something. What we want to do in outcome is establish a really fantastic goal that they want to move towards. In fact, it's going to be so good they can't do anything else but move towards it. P stands for prevent. So what might prevent you from achieving this change? So even though you've identified signs that you want to do something different, you've got someone who would support you and how they might encourage you, what they would tell you, and you've got a fantastic outcome that you're really looking forward and you're drawn towards. Our experience of lifestyle changes is that we don't always make them in the way that we want to make them. And that's often because there's a P in the way. There's something that's preventing us. And so sometimes it's useful. You know, the saying, forewarned is forearmed. So actually, if we can identify all the things that might get in the way of us achieving our goal, then maybe we can work our way around them or through them. And that's the purpose of the prevent section of the model. So I stands for ideas. And this is a great time of the coaching conversation, because people are then able and free to come up with some ideas that they can take forward towards reaching their own goal. And it should be their ideas. I know it's really difficult as healthcare professionals, because we've already got lots of really good ideas based on our experience and our knowledge, and we want to share that with people. But actually this is an opportunity to sit back and allow people to come up with their own ideas. And I would suggest that we encourage people to come up not with just one idea, but a number of ideas. Because actually change can be difficult. And actually if people just have one idea and it doesn't work out, it can almost reinforce the idea that change is difficult. So if one idea doesn't work out and you've got a list, you could try something else on that list that might work even better. T stands for timing. So at what time are you going to make a change, or are you going to start making a change? And what we recognize is that sometimes if we don't set a time scale that's realistic, or certainly in the near future, then all of our great ideas don't work out. And we've all had that embarrassing situation where we've met up with someone and we've said, well, let's catch up. Okay, and then a few months later, you meet up with them again and you haven't met up. And the reason you didn't is probably not because you didn't want to. It's just that no one at that moment took out the diary and put something in. So I do encourage my patients, if they've set themselves a goal, to kind of set them a time, a realistic time, that they're going to make a start with it.